Hey, hey, hey. Greetings and thank you for being here. I am Donna the doula with Serene Journey Births. And if you are watching this video, it's because you want information on labor induction, right? So being induced. Of course, subscribe, follow me on Facebook, follow me on Instagram, all that good stuff, right? Let's get right into it. So I like to begin with saying that while this in no way serves as medical advice, right? Let me get my camera straight. It is my mission to educate you, right? I'm here to just give you evidence-based information. You take that evidence and you figure out if it's safe or if the risks are worth it, right? Because sometimes the risks are definitely worth it. So you take this information and make your own informed decision. We're going to, of course, begin with what does it mean to be induced, right? The goal of induction of labor is to achieve vaginal delivery by stimulating uterine contractions before the spontaneous onset of labor. Well, what does that mean? Pretty much, you have not gone into labor and your primary care provider, your obstetrician, would like to get labor started before you have naturally gone into labor. And this is achieved by administering synthetic hormones. And I actually have a very detailed blog on my website that talks about all the hormones involved. So in this video, we're only going to talk about a few. So there are true medical reasons for induction. And a few of those are gestational hypertension or hypotension, right? So high blood pressure, increased blood pressure. Like a lot of women can possibly be fine their whole pregnancies, but towards the end, they can develop high blood pressure, right? You're stressed, your body, you're gaining more weight at the end of pregnancy. So there's a lot of different things that can cause more stress. Preeclampsia, post-term pregnancy. So if you are after 40 weeks, you are 41, 42, you definitely will be encouraged to get an induction. If you have maternal diabetes, if you have a premature rupture of your membranes, intrauterine growth retardation, right? So if you have like a really large fibroid or something else inside of the uterus that could possibly interfere with birth. And then multiple gestation if you have twins, triplets, or anything higher than that. So, how does our bodies go into labor? Tell me, let me know. Have no clue, right? Well, scientists have yet to discover the exact reasons why our bodies go into labor, but studies do heavily suggest that the babies release their own hormonal cocktail to let the body know that they are ready to enter the world. There are androgens, right? Stress hormones that are released because labor is a very stressful activity. So there are more androgens that the baby is releasing so that it can safely make its way through the birth canal. And the same for the mom. Androgens are being released so that her body can handle the pain of labor. One hormone that's very important is prostaglandins. This hormone actually thins the cervix out. This is released during orgasm. It's inside of the sperm, right? And this is why once you are at term, 39 weeks, 40 weeks, sex can be a natural inducer. And if you want to learn more about that, you can definitely check out my video on natural induction. Oxytocin is called the love hormone, right? It is released whenever we are doing things where we feel loved. Hugging, kissing, reading a love story, right? All types of love. Family, children, partners. Oxytocin is the love hormone. It also stimulates and produces contractions. So you need oxytocin in labor for the uterus to contract. And this is very important For hospital births in particular, right, it's very important that you feel safe, that you feel calm, and you feel comforted. Because if not, your body is going to decrease the amount of oxytocin that is produced. And once that happens, labor will slow down. Animals out in nature, if there is, for example, a cat giving birth in a wooded area, and she feels that there's a threat, oxytocin production is going to stop. She's going to pick up whatever kittens she already have. She's going to move them to safety. And then once she gets to safety, the oxytocin will begin to produce again, and she can have the rest of her kittens. It is the same thing with humans. If we do not feel safe, labor will be stalled. Right? So there are several different ways to be induced. You have synthetic prostaglandins. So remember a slide ago, I said that prostaglandins makes the cervix ready and makes it open up. So synthetic prostaglandins are typically placed inside of the vagina to soften and thin the cervix. So here's an image of a gel being inserted. And then you also have our second image, which is Cervidil, a medical called Cervidil. And it's kind of like a tampon insert, and they insert that around the cervix. Now, the medications are called Prepidil, Cervidil, Misoprostol, Cytotec. And of course, it is up to your provider which medication they are going to use. Not all hospitals carry all of the medications, right? And then they also will take your health into consideration, right? So maybe if you had a cervical collage or stitch in your cervix, they may not want to use Cervidil, they may want to use a gel. So it's just up to your provider. Misoprostol can also be administered orally, and Prepidil can be injected into a vein. Once these medications are given to you, there is no turning back. You cannot insert the Cervidil and then say, oh, I changed my mind. I don't want this process to go on. Once it's inserted, it is going to work. Your next inducer is Pitocin, right? I know a lot of you may have heard about this. This is actually the synthetic form of oxytocin, and it is given in your IV. It causes the uterus to contract. It is definitely seen more in women who are already in labor, right? And their labor is slowing down, and they want contractions to be a little more harder and effective. So it speeds up labor that has already begun, than as opposed to the other medications we just talked about. Those medications will completely start labor. Pitocin can be turned off for labor, right? So unlike the other medications, you can turn it off, you can stop it, and then labor can continue to progress naturally. Contractions in your baby's heart rate will be continuously monitored and movement will be limited. So here is a picture of a woman at during her labor, and she has her monitor. So the blue one is monitoring heartbeat, right, of the baby, and right, let me get it right. I think pink is heart rate of the baby, and blue is contractions. Yes. So because you are being continuously monitored, your movement is going to be limited. You're not really going to be able to walk around. You can always ask your hospital if they have monitors where you are able to walk around, or it's called, Lord, look at me, forgetting the name, right? It is where you take breaks. So you can be on for 20 minutes and you can be off for 20 minutes that way. So, the pros of induction, of course, is it can lead to a successful vaginal birth. That is what we want. Safe, successful birth. But it does not always happen like that, of course. 50% of inductions do lead to a cesarean birth. And this is largely caused by secondary reactions. And secondary reactions are the effects on mom's body. And when there is something wrong with the mom's body, baby cannot handle that. So, for example, you're at risk for developing a fever, especially with Pitocin. So, if you get a fever, then guess what? Baby is really not comfortable in there. You also can experience a change in heart rate, right? Some women, blood pressure goes up, some women, blood pressure gets too low. It can be on both ends of the spectrum. If you had something inserted into the vagina, or if your water has already been broken, you increase your risk of infection. Each time a vaginal exam is done, you increase the risk of the bacteria from the outside being exposed to the inside. And then, of course, with any of these methods, birth can go well, but after, you can have increased bleeding and hemorrhaging after the baby is born. Another side effect can be uterus hyperstimulation. So that means that the medicine is working too much, right? The uterus is contracting so hard and so fast that the blood flow doesn't get to baby, right? Because it's not rhythmic. We want contractions to be very rhythmic, and it's for a reason. This is, of course, going to lower baby's heart rate. If the baby heart rate keep lowering, especially during a contraction, they are definitely going to consider that fetal distress, and they are going to tell you that you have to get a cesarean section. Then our next one is, like I said before, continuous electronic fetal monitoring. So if baby is showing signs of distress, they are going to encourage you to not get out of the bed and not walk around. So if you are, of course, in that position, you have limited ability to move. And moving is actually what's going to make you feel comfortable, and it's going to allow you to endure the process of labor and the pain from your pressure waves, right? The pain from your contractions will be higher. Also, when you are induced, those labor pains are way more painful than natural labor pains. And then this, of course, will lead to the request of pain medication. And then once you have pain medication, that also carries the risk of developing a fever, getting too cold, high blood pressure, low blood pressure, and things of that nature. And once those things happen, if it happens for a long period of time or you do not get stable, then of course they're going to suggest, or sometimes not even suggest, you will have to have a cesarean birth. Right? So, overall, many inductions do lead to a safe vaginal delivery, but of course, we must take into consideration the births that don't. Because, like I said, 50% of women, their inductions do not go as safely as planned. If an induction is suggested, you definitely should take into consideration why. If you are 40 weeks plus, okay. If you, like I said, have gestational diabetes, if you have high blood pressure, things like that. And if it could hold off, right? If they're just saying, like, oh, I think it's just time, it's 39 weeks, you're uncomfortable. If it's really just more of seeming to be pressured, but it's not a life and death matter, there are several ways you can induce labor naturally. I am not going to go into that here, but I do have a video on the natural induction of labor, and I also have written a blog about it, right? You can read more on my website. And if induction is something that you think is best for you and baby, definitely go for it. You can always ask your providers what kind of medications they use. Also, ask them for more information on risk and benefits, because, of course, I did not want this to be a thesis video on each medication. Just giving you a little more information. And like I said, if you would like to read more, you can find my blogs on my Facebook page. You can find detailed posts written on my Instagram. And that's all I have for you. If you have any questions or comments, definitely leave them for me in the box and I will try my best to answer them. See you next time.